in. We need to lock it. Where's the locking stuff? Alright, I will be giving my patient his medication, Lasix and Lotensin. Lasix it's just for his edema, so it's a diuretic medication just to take away the excess fluid. And the Lotensin, that is just a pace inhibitor to lower his blood pressure because he's a little hypertensive. But before I do that, I'm going to make sure I check the medication against my MAR twice, against the doctor's order and also against the MAR to make sure it's the right medication. Going to also make sure I go check any contraindication, any side effects or adverse reaction the patient might have with it. Also check the medications that the patient is on, the patient's medication history, just to make sure that there is nothing that's going to contraindicate with it. And also, since I will be using normal saline to do the flushing, I have to also make sure that the medication is compatible with normal saline. So I'm going to make sure I get all the information that I need in checking the MAR. And then make sure I'm also using the patient 6 right. It is the right patient. I'm giving right patient the right medication, the right dosage, the right route for the nasogastric, the right route, it's the right time, and it's also just making sure that and at the end of the time it's going to be the right documentation. Alright, I'm gonna take my medication and then I will do my last checkup with the patient, making sure it's the right patient, also making sure it's the right medication. At the third medication check will be by the patient's side. I'm going to get their name and date of, introduce myself, get their name and date of birth, ask for any allergic reactions, if they're allergic to anything, introduce to them what I will be doing. It's going to be, I will be inserting, I will be giving you your medication through your nasogastric tube. Giving you Lasix, 20 milligram, and that's just for your edema, just to, it's a diuretic, just to take away any excess fluid in your system. And I will be giving you Lotensin, and that is just an ACE inhibitor to lower your blood pressure, since you're becoming, since according to your blood pressure, it's a little bit hypertensive. And just to make sure the patient is all right, I am going to perform hand hygiene, put on my gloves. To make sure I provided privacy, patient is comfortable, patient knows what's going to happen. Alright, I'm going to give my medication, and I will be also making sure that the medication is something that I can crush, so it's not an extended release, or or it's not enteric coated, so it's something that I can crush, because that is how I will be administering it. So I have my lowest Lotensin, 20 milligram. The Lasix, according to this, is 10 milligram, but since the doctor ordered 20 milligram, I'm going to use 2 tablets of my Lasix.
I'm really confused.
So 2 tablets of Lasix and 1 Lotensin. Crush it. Okay. Get my little cup. Pour it in here. And then you can always dissolve it. You can always dissolve it with water, hot water, or normal saline. Or probably hot water would be better to dissolve it, not to flush it. So making sure it's crushed up properly. Okay. Put in my medication. So I'm just going to just put a little bit of normal saline with it.
You go first? We can just do a quick video on that, right?
Just a little bit.
Yeah, I can.
Okay, pour it down in there. Then just stir it. Okay, now before I insert my medication, I have to also aspirate the nasogastric tube, just to make sure it is still in the right position. So I'm just going to aspirate. Alright, I see a little pea grain, so it's still in the stomach. Gonna put it back in there. Going to flush with 30 cc's of normal saline, and also that's just for the electrolyte balance. All right, 30 cc's of normal saline. It's a little hard to push, so I'm going to flush it in. Okay.
So if you come over
and I'm
here,
going to give my medication.
There's a little switch on the back. You need to know this so you look professional for the patient.
Okay.
Just push it.
And I'm also going to insert it into into the tube.
Comes off. And then when you put it back
Alright.
in, wait for the click.
Before I close it up, I have to also flush again for the last time with the normal saline, with another 30 cc's of normal saline. So drop another 30 cc's, insert it.
Alright, so we're going to
Okay, and you have to make sure before you close it, you have to just close it in for at least 30 minutes just for that medication to work its power and make sure that it is completely inside. And when I get back to plug the nasogastric tube back to the suction again, I have to also aspirate again just to make sure that there isn't any more medication that is lodged somewhere in the tube, and if there is, I'll have to just flush it in a little bit and just keep it in a little bit longer so that it can go down itself, and just make sure that the patient is safe, everything is all right, and then document against my center the amount of medication using the patient's rights again, so making sure I give the right medication, the right dose, at the right time, through the right route, through the nasogastric, making sure it's the right patient and the right medication. And I'm just going to also document the patient tolerance to when I was inserting the medication, and also like the side effects, which I explained to the patient. Some side effect that will be that dizziness, headache, drowsiness, and also make sure I told the patient teaching would be just to make when they're coming from a laying down position to a sitting or a standing, they're standing up slowly as well. And also, as a nurse, my intervention is also to make sure I monitor the patient's blood pressure frequently so they don't become hypotensive. Just make sure I document everything, and also the amount of normal saline that was used to flush, and if the patient vomited or did anything, amount of output that was vomited, and just make sure the patient is safe and all right.